Good day, everyone. I am Elika Ule from Group 5, and I'm here to discuss with you the continuation of our report about lower respiratory system and some drugs that are used to treat lower respiratory tract diseases. So now, my report is about Anoro Ellipta. Its generic name is umeclidinium vilanterol. But before we proceed, let me give you an overview of what is COPD. COPD, or chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Its symptoms include breathing difficulty, cough, mucus production, and wheezing. It's typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and a variety of other conditions. In COPD, emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. When we say chronic bronchitis, it is an inflammation of the lining of the bronchial tubes which carry air to and from the air sacs or alveoli of the lungs. It is characterized by daily cough and mucus production. So in the image at the right side, you can see healthy and inflamed with excess mucus bronchioles. Next is emphysema. It is a condition in which the alveoli at the end of the smallest air passage of the lungs are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases and particulate matter. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as reduce risk of other associated conditions. First, let's discuss the pharmacological class in which Anoro Ellipta belongs to. Pharmacological class. Anoro Ellipta contains two medications, the umeclidinium and bilanterol. The umeclidinium belongs to a class of drugs known as the anticholinergics. The anticholinergics are a group of substances that blocks the action of neurotransmitter called acetylcholine at synapses in central and peripheral nervous system. Anticholinergic symptoms include dry mouth, constipation, urinary retention, and increased heart rate. Vilanterol, on the other hand, belongs to the class of drugs known as long-acting beta-agonists or the LABAs. The long-acting beta-agonists are taken on daily basis to relax the muscle lining, the airways that carry air to the lungs. This allows the tubes to remain open. Both drugs are also known as bronchodilators. When we say bronchodilators, it dilates the bronchi and bronchioles, decreasing resistance in the respiratory airway, and increase the airflow to the lungs. Now, let's move on to the therapeutic indication of Anoro Ellipta. Therapeutic indication of Anoro Ellipta. Anoro Ellipta is combination anticholinergic and long-acting beta-2 adrenergic agonist. Indicated for the long term, once daily, maintenance treatment of airflow obstruction in patients with chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. Anoro Ellipta is not indicated for the relief of acute bronchospasm or for the treatment of asthma. This medication must be used regularly to be effective. It does not work right away and should not be used to relieve sudden shortness of breath. If sudden breathing problems occur, use your quick relief inhaler as prescribed. Umeclidinum vilanterol or Anoro Ellipta is not approved to treat asthma. People with asthma using long-acting inhaled beta agonists such as vilanterol without also using an inhaled corticosteroid may have an increased risk of serious breathing problems. Okay, let's move on to the mechanism of action of Anoro Ellipta. Mechanism of action of Anoro Ellipta. There are two components of Anoro, the LAMA and the LABA. The LABA promotes the bronchodilation and the LAMA inhibits bronchoconstriction. So the LABA or the vilanterol, it activates beta-2 receptors and promotes bronchodilation. The LAMA, on the other hand, the omeclidinium, it inhibits binding of acetylcholine to muscarinic receptors. It blocks the bronchoconstrictor effects of acetylcholine, leading to bronchodilations. The two components, the LAMA and the LABA, could help maximize bronchodilation. COPD symptoms look different for everyone, so consider if a LAMA or a LABA is right for your patients. Next is dosage information. Dosage information. Anoro Ellipta should be administered as one inhalation once daily by the orally inhaled route only. Anoro Ellipta should be used at the same time every day. Do not use Anoro Ellipta more than one time every 24 hours. No dosage adjustment is required for geriatric patients, patients with renal impairment, or patients with moderate hepatic impairment. Next would be the clinical studies of Anoro Ellipta. Clinical studies. The safety and efficacy of Anoro Ellipta were evaluated in a clinical development program that includes 6 dose-ranging trials, 4 lung function trials of 6 months duration. There are 2 placebo-controlled and 2 active-controlled, 2 12-week crossover trials, and a 12-month long-term safety trial. The efficacy of Anoro Ellipta is based primarily on the dose-ranging trials in 1,908 subjects with COPD or asthma and the 2 placebo-controlled confirmatory trials with additional support from 2 active-controlled and 2 crossover trials in 5,388 subjects with COPD. Now, let's discuss some of the advanced improvement applied of this drug. This is an example of advanced improvement applied in Anoro Ellipta. The GSK or GlaxoSmithKline study demonstrates superiority of Anoro Ellipta to Stiolto-Respimat in improving lung function in chronic obstructive pulmonary disease. GlaxoSmithKline and Innoviva today announced positive data from a study comparing a once-daily long-acting muscarinic antagonist, and a long-acting beta agonist or LABA, fixed-dose combination, Anoro and Stiolto-Respimat for symptomatic patients with chronic obstructive pulmonary disease. The primary endpoint for this 8-week open-label crossover study of 236 patients with COPD was the demonstration of non-inferiority of UMEC-VI or the Anoro Ellipta compared to Stiolto-Respimat in improving lung function as measured through forced expiratory volume in 1 second at 8 weeks. This endpoint was met, and furthermore, Anoro Ellipta demonstrated superiority to Stiolto-Respimat. This data demonstrates that Anoro provides superior lung function improvements to the comparator Stiolto-Respimat. Lastly, we will discuss or give our conclusions about this drug, and let us also review other informations about Anoro Ellipta. Now, we conclude that Anoro Ellipta is used to control and prevent symptoms such as wheezing and shortness of breath caused by ongoing lung disease or COPD, which includes chronic bronchitis and emphysema. This inhaler contains 2 medications, the omeclidinium and vilanterol. Both drugs work by relaxing the muscles around the airways so that they open up and you can breathe more easily. Omeclidinium belongs to a class of drugs known as anticholinergics, and the vilanterol belongs to the class of drugs known as long-acting beta agonists or the LABAs. Both drugs are also known as bronchodilators. This medication must be regularly used to be effective. It doesn't work right away and should not be used to relieve sudden shortness of breath. If sudden breathing problems occur, use your quick relief inhaler as prescribed. Omeclidinium, vilanterol, or Anoro Ellipta is not approved to treat asthma. People with asthma using long-acting inhaled beta agonists such as vilanterol without also using an inhaled corticosteroid may have increased risk of serious or sometimes fatal breathing problems. Let's discuss some of drug interactions of Anoro Ellipta. Caution should be exercised when considering the co-administration of Anoro with ketoconazole and other known CYP3A4 inhibitors, as increased systemic exposure to vilanterol and cardiovascular adverse effects may occur. Also, beta blockers must be used with caution. It may block bronchodilatory effects of beta agonists and produce severe bronchospasm. Anticholinergic may interact additively with concomitantly used anticholinergic medication. And that's the end of our discussion. Thank you for listening.